Good morning. I'm Dr. John Littell, and I'm coming to you today from my office here in Ocala, Florida, to talk about a concept that is really going throughout our entire nation, which is the concept of making America healthy again, MAHA. It's a great acronym, even a better concept, and obviously one that's near and dear to my heart as a family physician for the past 35 years. This is my vocation, making the people whom I meet healthy. And as I look at what's happening with making America healthy again, there's some very important concepts upon which we can all agree. Improving our food supply is paramount. I don't need to get into those details. Most of you have seen what's going to happen and what needs to happen in our country so we don't have the sickness, the sensitivities, the immune deficiencies and other things that I believe and others believe come from eating a relatively toxic food supply. And then we have water issues such as the fluoridation of water. And yes, removing potentially toxic fluoride from water is certainly going to make some kind of improvement or lead to improvements in the health of our nation. But it comes down to this. When you need a doctor, you need a doctor. We can get everybody to stop eating junk food and less processed food and all these wonderful things that we need to do to make America healthy again that have been discussed already. But let's face it, I see day in and day out patients who are leaving other doctors' offices to come here because those other doctors are not doctors whom they can trust. They have lost complete trust in the medical profession. This has been proven in the Journal of American Medical Association, especially because of what happened during COVID. Now, let me say this out front. Many of the doctors, if not most, of the doctors in hospitals that were wrong about COVID are still excellent doctors. They're the best and brightest minds we have in the world in areas such as neurosurgery, cardiovascular surgery, general surgery. These are people who are saving lives day in and day out, who were wrong about perhaps what should have happened with COVID and certainly the COVID response in the hospitals. My goodness, we could talk about that in another whole segment. But no, you can't deny the fact that we have what it takes to be the healthcare system in the world. But I'm imploring you to work with me in seeing how we can again restore trust in America's healthcare system. Because again, if you have a sick child with 103 fever who's crying uncontrollably, you want to find a doctor you can trust. If you're a pregnant woman who's bleeding, you want to find an obstetrician you can trust. If you're an active athletic male who's beginning to experience exertional chest pain, you want to know to whom you can turn. Where should you go? Do you go to the emergency room? Or do you find a doctor you can trust? Do you do this as an outpatient or an inpatient? You all need guidance. We all need guidance as to where to go when we really need a doctor. And so let's think about some of the ways in which the medical profession has caused this lack of trust. And by the way, I've not always been the doctor that I am today. Let's talk about vaccines. I routinely vaccinated every child. My own 5 children, have been vaccinated against all those diseases that are available to be vaccinated against. And yet now my mentality, my philosophy has changed because I've learned about some basic principles of immunology and what's happened with the vaccine industry over time. And so I see patients who've been kicked out of their doctor's offices, pediatricians' offices, because they just want to question the need to give their baby all these vaccines when in fact they already have a 4-year-old that has autism, and they just question in their mind, is there a connection? Or there may be other autoimmune disease in their children. So they're questioning. They want a doctor with whom they can have a dialogue. And so they deserve to be able to ask those questions. Similarly with medications. The patients come to me left and right, and they're on medications they want to get off of. One of the best examples nowadays are statin drugs. Do you realize that the insurance companies will penalize me financially if I don't keep people on statins, which are meant to be for hyperlipidemia, high cholesterol, not always necessary for hyperlipidemia, and yet they say if your patient's a diabetic or has had heart disease, et cetera, they need to be on a cholesterol medicine even if they have perfectly normal cholesterol. So go figure. But we do get financially penalized there. We can't even, the patients come to me, I give them an option, even though they're cardiologists and other doctors may not. That goes for so many medications that we use. And then there's procedures that are done routinely in medicine. Patients are wondering, do I really need this procedure? Do I need this mammogram every year? Do I need this pap smear? By the way, I wrote a whole book about that. Please check it out. Do I need to have a colonoscopy every 5 years? Or can it be wait 10 years? Or do I need it at all anymore? Procedures are not without risks. And yet you have to understand that when Medicare was rolled out in 1965 as part of the Great Society by LBJ, all of a sudden the way doctors were paid was based on procedures. And that's why we have this guidebook called CPT, Current Procedural Terminology. If you can throw procedures in, your compensation goes up 2-3-fold. If you can do more, if you can cut a bigger skin lesion out, you get paid more. It's really a perverse incentive to do things that ought not to be done. And there you go. Trust. Why would you trust someone who's working on a profit motive and not in your best interest? And then, of course, the hospitals, which were paid all kinds of money during COVID if they could swab a person and find out if they had COVID positive status. And even if they weren't sick with COVID, they got paid $10,000 to $20,000 more for every admission for COVID. And if they used the COVID protocol. So that is one of the many reasons why people lost faith in hospitals during COVID. They're like, oh my gosh, am I just another number? Am I a way to generate more revenue? Or I'm actually a patient that's a person needs care, that's going to get the care they need. And so here's what I got to tell you, folks. Hospitals are providing excellent care. Don't get me wrong. It's Saturday morning, just last night, 9 o'clock at night, I was holding the hand of one of my patients who's been suffering a long time from chronic pain. This poor woman had had an accident at home and crushed her leg, and now she was in danger of either losing the leg, or if she kept the leg any longer, it's possible she would have gotten septic. Her blood pressure was already dropping. She was on medicine to keep it up, and the trauma surgeon had just walked in and said, you need to go to surgery and we need to open up the leg and let some of the pressure out of there. The emergency room physicians, residents, interns, others were there, and when I walked in and she saw me, I went right to her head, the head of her bed. I put my hand on her forehead. She grabbed my hand. She said, Dr. Littell, I don't know what to do, but I trust you. I trust you. And therein is the essence of medicine, right? That patient-physician relationship built on trust. She had never met the trauma surgeon. She didn't know these ER doctors that were running around, but she knew me, and I knew that this procedure that she was going to have could well save her life. I also knew there was a downside to it. It could cause her weeks of more misery and possibly never recover. So I had to really go within myself and try to hear that small, quiet voice that tells me what's the right thing to do based on my education experience, based on my trust of those doctors who thankfully I knew, especially the trauma surgeon. So this trust has got to be there in medicine. When you need a doctor, you need a doctor. And you need a doctor that you can trust. And how do you know you can trust that doctor? I'll give you just a few basic principles. Does that physician observe the principles of the laws of nature? Does he follow the way that nature has put our bodies together, fearfully and wonderfully made, right? Seems to be a basic concept, but if he has a disregard for life's basic principles and for life itself, you wonder why he should be taking care of you. Also, we already alluded to the fact you deserve to make informed decisions about you and the health care of your children, your family, your mother, your father. If that doctor is just saying this needs to be done and doesn't want to hear it, it doesn't want to have any dialogue, doesn't want to engage you in a conversation, then you really have a problem there and you don't trust those people. And similarly, if that doctor is not laying out the potential harms, that initial and most essential tenet from Hippocrates, primum non nocere, first, do no harm. Everything comes with a harm. Every procedure, every drug, as they say, or should be saying in every medical school, every drug is a toxin used to counter an even greater toxin or greater evil. Every drug does harm, potentially. We're just trying to overcome a greater harm by prescribing a drug or performing a procedure such as last night with this patient. So, first, do no harm, allow for informed consent, follow the laws of nature, the laws of God, respect for life's principles, and then most importantly, you see this stethoscope I have here. I've had the privilege of examining thousands and thousands of patients in 35 years, and I'll listen to them tell me their stories. And by the way, what a privilege it is to hear the stories, right? That's really why I love medicine, because people share so much interesting stuff with me about their lives, the lives of their families, and in learning how to make them healthy again or keep them healthy. Those stories are so important. And so we listen to those stories, and then I get ready for my physical exam, and I'll listen to their hearts. Let me listen to your heart, I say. Well, hopefully I've already listened to their hearts, right? Hopefully, like in this painting behind me, that was from 1891 by Luke Fildes, and it's appropriately entitled The Doctor. And you see that doctor in the background with a very, very sick child, possibly with rheumatic fever, rubella, who knows the diseases she could have had, and the mother distraught with her head on the table, the father consoling the mother, the cup of coffee behind the doctor, the lamp that's just tilted so that he can observe this child. And he has to listen to that small, quiet voice within him, that intuition based on years of experience, to come up with a diagnosis and a treatment modality at a time when there were very few things, very few options, right? And yet, just him being there in their home was therapeutic, was it not? I had doctors make house calls for me when I was a sick asthmatic child, and I've made house calls when I was in Montana, especially 50 below zero weather in the winter, and a woman not sure if she needed to go to the hospital in labor yet, or a child with an asthma attack. What an honor, what a privilege to go into the home of a patient, huh? And what a privilege to have them come into my home here, my office, and spend time with them and hear their stories, listen to their stories, and to listen to their hearts. And that's what I'm asking you to help me do in this next years as we try to restore trust in the medical profession. If you're in the healthcare profession, go back to that stage in your life when you wanted to become a doctor or a nurse and you understood the vocation. Don't get cynical, because even though everyone's telling us how to do our job, these people have no idea. These people in DC, the insurance companies, the quality councils, all the agencies that you can name. Now we know what it is because we're here with the patients. And I would just ask you to remember those basic principles. Observe the laws of nature and of God. Allow for informed consent. First, do no harm. And take time to listen. Take time to listen. And if you listen, you're going to hear a lot. You're going to not only hear what's wrong with that patient, but you're going to have, I believe, an opportunity to be fully present to that patient in a way that they haven't experienced, and that we need to experience more and more in a healthcare system that's gone off the rails. Yeah, let's make America healthy again. Let's restore trust in the medical profession. Let's bring back the vocation of medicine. And I'll pray that you find physicians who will listen to you. And I'll pray for these young medical students coming up to be the kind of physicians who will be open to listening and hearing. And God bless you. Thank you for your time. Have a blessed day.